What's going on with these pertussis outbreaks? Hi, I'm Dr. Brittany Todd, and I am a pharmacist, and I want to talk to you about what's going on with pertussis. So there have been an increased number of cases of pertussis this year, and some people are saying it's because of the vaccine hesitant, we're not vaccinating as much, but that's not necessarily the case. In fact, if you look at the CDC website, they will not report the data like they do for measles. If you look up measles on CDC, it will tell you hospitalization, number of cases, number of deaths, and how many people are vaccinated versus unvaccinated. If you look up pertussis, they don't mention any of that. Do you know why? Because the vast majority of pertussis cases are currently happening in people who are vaccinated for pertussis. Why is that? Well, pertussis vaccine gives you immunity to pertussis, but only for a very short time. The recommended duration between pertussis boosters is actually 10 years, unless you have some other indication to get it, like pregnancy. The immunity actually wanes to less than 10% immunity by year 4. So most people who got their booster for pertussis, which comes in the combination vaccine, tetanus, diphtheria, pertussis for adults, Tdap, are probably walking around with no or little to no immunity. What's really interesting, though, is if you have pertussis, the actual wild type pertussis, you're symptomatic and you're not going to go anywhere because you don't feel well. It's like common cold with cough on steroids. But when you're sick, you don't visit newborns, you don't visit other people. The nice thing about wild type pertussis is now you are immune to pertussis for anywhere between 7 years and 30 years. And each time you are re-exposed to pertussis, your body will just update its antibodies and its immunity. So you can actually have almost lifelong pertussis protection. And because of that, you also will not get infected, which means when you're playing with babies or walking around in your community, you're not even contagious, even if you were exposed to pertussis. The most dangerous people to be around are vaccinated people for pertussis who are asymptomatic but still infected. So that's what's going on with pertussis. The reason our rates are so high is because people don't have natural immunity to pertussis. They're requiring a vaccine to give them that artificial immunity that wears off after just a couple of years.